Okay, so for this video, I will be demonstrating how I would conduct a mental health assessment on a resident. However, I don't have someone to practice on, and a pillow is not very helpful for that. So I will be walking you through how I would conduct a mental health assessment, what I would ask, what I would be looking for, and what tests are typically conducted. So I would go in, I would do my hand hygiene, I would use my hand sanitizer, I would introduce myself. I would say, "Hi, my name is Juliana. I will be your student nurse today. Today I was asked to come in and perform a mental health assessment on you." So what that is that typically consists of me asking you a couple questions about your medical history, and I will be asking you to do a couple simple tests today so I can assess your mental health and cognitive ability. Is that okay with you? And if they said yes, then I would proceed. So I would ask them if they've had any history with mental illnesses and take any medications to treat any mental illnesses, and I would ask if there has been any stressful or upsetting incidents within the last couple of weeks, such as a loved one passing away, a loved one falling ill, moving into a home, as that could interfere with someone's mood, and one could take that as depression when it's actually being upset over typical life events or stressful life events. From there, I would ask them their mood over the last couple of weeks, how they're feeling today, because that could help me assess their mood or their mental status. And throughout our interactions, I would assess their posture, their ability to understand questions, and to be able to follow along. I would also assess their level of consciousness, so if they're paying attention, if they're following along, if they're keeping eye contact, etc. I would ask them what questions to determine their orientation, to determine if they're able to orient themselves with what's around them. I would ask their name. I would ask questions such as what time is it right now, or the date, and I could ask them where they are, because that could help to determine their level of mental clarity as well. I would also be determining their cognitive well-being, so I would assess their ability to follow simple instructions. I would also assess their short-term memory, by saying a few words such as popcorn, clock, shampoo, and I would ask them to remember those words. Keep those words in the back of your head. And then I would go and I would do another test, and this is the clock drawing test. So I would give the resident a sheet of paper and a pen, and I would ask them to draw a clock, an analog clock, and then I would ask them to place the hands typically at 12 and 3, and then I would look at that. If the clock is normal, the hands are in the correct spot, that's a normal finding. However, if the numbers are not in the correct spot, or if the hands are off, then that is an abnormal finding and signals that further testing needs to be done for their assessments. And then once that was done and a couple minutes had gone by, I would ask them to come back to those words, see if they could remember those words and say those words, because that means they have a strong short-term memory. And from there, I would wash my hands, I would say thank you for helping me assess you today, and I would be done. That would be that.